in our office, each of the chiropractors or our office provides many different diverse ways of taking care of people that's personalized for you. So personalized or custom treatment for each individual that comes in. And one of the things that we offer is a flexion distraction where the table actually moves and stretches the spine. So I'm going to demonstrate a little bit of that. It's called Leander Flexion Distraction, is the particular chiropractic table that we use in the office. When patients come in, it gives them a chance to lay down. They have sometimes heat or ice that's placed on them to relax, but also the table starts moving, and the table can be used in many different ways. And so I'm going to show you some of the basic ways that the table's used on a really low setting, so that when people have maybe lower back issues, disc issues, sciatica, SI, scoliosis or curvatures of their spine, even degenerative discs, or name a bunch of different things that can be going on with people, that makes it gentle and easy for them. So I'm going to start out, the table's typically at a level starting out, and it's at a very low setting. So people that aren't used to this movement, we have to build your body up to some of these movements. It's like working out. Your body cannot, it's sometimes a really big change for people. It takes time. If you go to the gym, it takes about 3 to 4 weeks for you to feel different or for your body to make the changes. So about 30 days is like the golden rule that you hear in changing if you start a new habit. So I'm going to start the table up. It's going to start a very low and gentle distraction. When the patient's placed on the table in a certain way, the table acts as almost a fulcrum. And so it actually stretches or concentrates that area. So a lot of time patient positioning is really important, to where if you say, oh, it's down in my lower back, and you go like this to me, well, I can say, well, I need you to move down or move up on the table so you can feel that effect. As you lay here, that distraction, you'll kind of feel it, especially when that area is out of balance, or we call misaligned, you'll feel it a lot more. We can accommodate for the different body types by releasing the middle section in case people have a little bit more in front in here. Some of our moms that are pregnant as well, we have a special cushion for them that accommodates. So literally they can lay pretty much all the way up to delivery face down on this specialized cushion by releasing this. I'll show that on another video for you guys, but having that release, it creates a traction in there. So while the heating pad's on you, it's allowing your body to relax. In fact, most of you guys, most of the patients, including myself, you haven't laid down all day or taken care of yourself all day, and finally you come in and it's like just this breath of fresh air, to like say, oh, just a moment for myself. And so this table's going really gently on there at the low setting. Of course, over time, the doctor, when we come in, we typically place our hands on the body. One, to say a little bit of hello before we start working on you, but also to make you feel comfortable and in trust, because I think the biggest thing is that patients, including me, is probably the most important sense in your body that we don't experience enough of is touch. It's the one sense you cannot live without as a being, or a human being, or a life. You can live without sight, you can live without taste, you can live without smelling, hearing, just fine, adapt to it. But touch is probably the biggest element of people. So all the chiropractors or healers that are out there, that is probably in my opinion, is part of the healing process for every one of you, including ourselves. That when we place our hands on you, it's the opportunity. Oh, we could do another video. Madonna, who's videoing here, said, "You got big hands." I said, you know how many thousands of people I've seen over the almost 30 years of care? Anyways, so sidebar. So we'll do a stretch into the spine to help with the paraspinal muscles, all the muscles from the head down to the tail, and this is moving. And we'll go in different patterns and different directions on someone's spine and body, just to get a feel and stretch it. We also, sometimes, we'll even elevate it just a little bit. So I'm just gonna bring it up another 25%. 1001, 1002. So now that angle of traction went up higher. We make those changes as we're in the room, not when we're not in the room on there, so we can monitor and make sure you're safe on here. There is, of course, an emergency stop that we use on this table, that you can stop the table at any time, whether we're in the room with or without you. So we show that to all our patients to make sure they're safe in there. So I'm going to start it back up again. Oop. Helps push start, right? I'll bring it up again. Now I'm going to bring it up all the way, and this is graduated, where this table actually elevates to this level on people, and sometimes you go to this level with people. When I'm actually working, you can see how deep that traction is on there and distracting that area. And what it does, it hydrates the discs, hydrates the tissues, gets them moving and bending more than they're used to. You know, so it creates a gentle stretch and traction. It could be controlled by speed. I could slow it down, or I can simply speed it up. And now you can see it go, we don't want to go too hard on there, but it does go a little faster. I'm going to bring it down just a little bit right there. And we're going to speed up just a bit so you can see. Can you see that?
Yep.
Where it's going a little faster, but we really mess with the speed on there just because it's nice and easy. It's a more of a controlled, gentle force. I'd rather have a deeper traction over time than the speed of it. And so that's controlled, and people, so initially when you start out with that, you feel this great amount of tension in your back and it starts to dissipate. So some of our docs here, and I'm gonna bring this back down again to a more controlled level here. So this will be about level, and so that you can tell that was quite a bit of distraction in there, and people have to build up to that, and that takes a lot of time. Okay, so it's there. The other thing that the table does is we'll modify some of our treatments with it. Instead of putting you on your side adjusting, we use drop pieces that allow us to adjust the lower back and the lumbar spine, the pelvis, your SI joints, the sacrum. We can use this drop for adjusting the extremities. We also adjust full body, or full spine, full body, meaning not just the spine. We do all the extremities, your shoulders, your hips, your knees, your feet, your hands, your wrists, if you have carpal tunnel, GERD, gastric reflex. You know, chiropractors take care of those things. So you can see how that, but we also, like if we know a disc is sitting to the side, we can also like angle it differently to get a little more stretch into the body. And that includes, while it's moving, the drop can go, and look at how it goes down, and we can start to drop and work with the body, lightening the tension on it, where, let's see if I can get this here. I'm hardly even putting any pressure. We can keep it really light. And the purpose of the drop is like, it's like a recoil. Like in physics, when the hammer hits the nail, it's not the hammer hitting the nail that drives it in, it's the hammer quickly coming off the nail that actually drives it in, the forces. And it's kind of like what I describe to people. Sometimes it's, well, we'll just stick with the nail part of it on there, or a martial artist. That was the one I was thinking of. Martial artists, when they strike, it's not the strike, it's the recoil, the drawing back that creates that initial, that energy. The quicker the drawback, the quicker the energy or the explosion. And it's the same thing, it'll create this recoil in there that makes change, and you're putting energy into the body through force, either through our hands or various tools that we use to make change so it starts to function. So we can bend the table sideways, all like this.
That was great.
We can adjust the middle back as well, you know, if they have, you know, so there's a lot of techniques and pressures that we can do differently for all you guys, all of us, to make sure it is a comfortable experience on that. The docs are always checking in with patients to see how they're doing, and you'll see that with the reviews that We check in with you to make sure you're satisfied with the treatment. If there's something that needs more attention, whether instrument, we have more time, more frequency of it, maybe more drops. Instead of like using the drop 3 times, now we're going to use it 5 or 7 times in the area to start moving it or move in a different direction. But we check back in with you. You're better now. How does that feel to you? And you let us know, and we check in. Are you happy with your treatment today? Are you satisfied with it? Oh yeah. Or if you're not, we readdress that before you go as much as we can. Sometimes we do have to make a call, like if we overtreat, you could be really sore, or sometimes we're moving the body too quick before it's ready to heal. Also, like sometimes we'll do techniques that allow us to do the drop, for the cervical spine as well, through a gentle motion. And we can accommodate people, when they lay on their back and make sure they're more comfortable. So this table has a lot of great uses that can customize the treatment for you instead of just like cracking you the same way without like personalization or customization to you, because everybody's different. Shapes, sizes, and how they feel about their body on that. So we're always checking in. Sometimes people will say, I had a little firm adjustment, now a little softer in feel, or if it's just not a day to address something different, just let us know. So I think that was pretty darn good.
Perfect.
For there.